Making sense of Colorado's updated COVID vaccine situation. What you need to know. The landscape of COVID-19 vaccinations in Colorado is changing. And while everyone aged 6 months and older can now seek the updated vaccine, the financial implications depend significantly on their insurance coverage. For many, especially those without comprehensive insurance, this shift has raised some pressing concerns that are hard to ignore. In the beginning, a prescription was necessary for pharmacies in Colorado to dispense the updated vaccinations. However, new regulations now enable pharmacists to administer vaccines recommended by the Centers for Disease Control and Prevention, CDC, without needing a prescription for each patient. This change, highlighted by Dr. Ned Kalange, the state's chief medical officer, came in response to the need for greater access to vaccinations. Dr. Kalange issued a standing order that essentially acts as a blanket prescription, empowering every eligible resident to obtain their vaccine from retail pharmacies. But it's essential to understand that having this standing order does not inherently guarantee that insurance will foot the bill for the vaccine, nor does it ensure that pharmacies will stock the doses. Alarmingly, data from last year revealed that less than 50% of individuals aged 65 and older received the new COVID-19 vaccine, indicating a worrying trend that continued in younger demographics. Dr. Kalange noted, the standing order enhances accessibility. Unfortunately, it doesn't ensure availability. Recently, the Colorado Division of Insurance proposed a draft regulation aiming to mandate state-regulated insurance plans to cover COVID-19 vaccines at no out-of-pocket cost for all age groups, if approved. This regulation would apply specifically to health insurance plans regulated by the state, which typically have the letters CODOI printed on their cards. However, it is crucial to note that this new rule will not include federally regulated insurance plans, which represent around 30% of employer-sponsored insurance in Colorado. These plans often aim to provide competitive advantages for large employers. So there are hopes that they would strive to match the benefits provided by state-regulated plans. Dr. Kalange expressed optimism that these insurers would not want to lag behind their competitors. This situation is not unprecedented. Previously, residents with state-regulated insurance faced limitations, unable to receive guaranteed benefits available to those with federally regulated plans. For instance, while Colorado imposed a cost cap on insulin and epinephrine shots for state-regulated plans, it couldn't mandate similar caps on those that fell outside its jurisdiction, leading to a strain on affordability for many. In terms of the COVID-19 vaccines, at least 2 insurance companies in Colorado confirmed they will cover the vaccinations across all plans. Select Health, which provides Medicare and Marketplace plans, assures its members that COVID-19 vaccines are fully covered with no associated out-of-pocket costs. Similarly, Kaiser Permanente Colorado confirmed it will cover the vaccine for individuals aged 6 months and older. However, some organizations remain cautious, needing to clarify how and when they will cover these vaccines. One notable provider, Anthem, has recognized immunizations as medically necessary if recommended by significant health organizations such as the CDC, yet it did not clarify whether charges would apply for those vaccines deemed medically necessary. The intricacies of coverage at Anthem depend on whether specific vaccinations are deemed optional or required by the CDC, presenting a complex situation for their members. As of now, Colorado's Medicaid program is still awaiting clarity from federal authorities regarding which vaccines can be covered. Moreover, Medicare has not yet commenced covering these updated shots, leaving many wondering what the future holds as they navigate the vaccination landscape. For the majority of the COVID-19 vaccine's relatively short history, they were readily available and suggested for everyone over 6 months without direct costs. However, in 2024, a significant change occurred when the federal government ceased funding, signifying that uninsured individuals could now potentially face out-of-pocket expenses to receive the vaccine. Typically, insurance plans were required to cover the vaccines, as they were endorsed by the CDC's Advisory Committee on Immunization Practices. Historically, this committee provided recommendations quickly following FDA approvals. However, the last FDA approval extended specifically to populations at higher risk of severe illness, such as older adults and individuals with specific health issues. Doctors retain the ability to prescribe the vaccine in an off-label manner, similar to how adult medications can be provided to children when necessary alternatives are not available. Still, with upcoming meetings of the CDC Advisory Committee, decisions about vaccine recommendations remain uncertain. The appointment of new committee members who may not align with previous stances could further complicate matters, raising questions about the future of vaccination recommendations. Importantly, the outcome of these recommendations will dictate whether programs aimed at providing vaccines to uninsured children will continue. The implications of this situation and the linked legislation governing insurance coverage are profound. As healthcare experts like Kathy Bradley from the Colorado School of Public Health emphasize, it's crucial for states to explore alternative methods to maintain vaccine access for their populations. Ultimately, the ability for any resident who desires a COVID-19 vaccine to access one through their preferred provider represents a significant step forward for Colorado. As the circumstances evolve, they will require innovative approaches to ensure that all residents continue to have access to necessary health care. It's a unique journey for everyone based on their specific coverage, but the importance of preventing severe illness remains crucial, Bradley concluded. If you have thoughts or experiences regarding access to COVID-19 vaccinations or insurance coverage challenges, we want to hear from you. Share your insights in the comments below.